Cefotaxime is a third-generation cephalosporin used to treat susceptible gram-negative and gram-positive bacterial infections. In this video, let's found. What is cefotaxime? What is cefotaxime used for? Contraindication. What are the side effects of taking taxime? How does cefotaxime work? How to use cefotaxime? What is cefotaxime? Cefotaxime is an antibiotic used to treat a number of bacterial infections in human, other animals, and plant tissue culture. Specifically in humans, it is used to treat joint infections, pelvic inflammatory disease, meningitis, pneumonia, urinary tract infections, sepsis, gonorrhea, and cellulitis. Cefotaxime was discovered in 1976 and came into commercial use in 1980. It is on the World Health Organization's list of essential medicines. It is available as a generic medication. What is cefotaxime used for? Used to treat gonorrhea, meningitis, and severe infections including infections of the kidney, pyelonephritis, and urinary system. Also used before an operation to prevent infection after surgery. Contraindication. Hypersensitivity to cefotaxime is an absolute contraindication to its use. Patients with known allergies to penicillin or other cephalosporins should also avoid cefotaxime. Side effects. Local reaction, pain, swelling. Hypersensitivity, rash, pruritus, anaphylaxis. Gastrointestinal effects, nausea, vomiting, diarrhea. Pseudomembranous colitis. Headache. Elevation in liver enzyme. Elevation in BUN and creatinine. Hematologic, neutropenia, leukopenia, agranulocytosis. Pharmacodynamic. Cefotaxime is a third-generation intravenous cephalosporin antibiotic. It has broad-spectrum activity against gram-positive and gram-negative bacteria. It does not have activity against Pseudomonas aeruginosa. Cefotaxime works by inhibiting bacterial wall biosynthesis. A positive feature of cefotaxime is that it displays a resistance to penicillinases and is useful to treat infections that are resistant to penicillin derivatives. Mechanism of action. The bactericidal activity of cefotaxime results from the inhibition of cell wall synthesis via affinity for penicillin-binding proteins, PBPs. Cefotaxime shows high affinity for penicillin-binding proteins in the cell wall, including PBP-IB and PBP3. Half-life. Approximately 1 hour. Dose. The dose of this medicine will be different for different patients. Gonococcal urethritis/cervicitis. 0.5 g/m once. Gonorrhea, rectal. Men, 1 g/m once. Women, 0.5 g/m once. Infections caused by susceptible organisms. Uncomplicated, 1 g4 or IMQ12HR. Moderate to severe, 1 to 2 g4 or IMQ8HR. More serious, bloodstream infection, septicemia, 2 g4q6-8HR, life, 2 g4q4HR. Not to exceed 12 g/day. Preparation for surgery. Prophylaxis of surgical infection. 1 g/m/4 once 30 to 90 minutes before start of procedure. Safety advice. As cefotaxime is safe for use during pregnancy, FDA Category B, it might be efficient for the prevention of early neonatal sepsis due to ampicillin-resistant Enterobacteriaceae, mainly E. coli. That's all the information about cefotaxime we collected. Thanks for listening. Do not forget to like, share, and subscribe for the HeInfo channel if you like this video to update more health information.